Good evening, everyone. It gives me great pleasure to you all to introduce today Dr. Rana Mohammad Sadiki. He's an ST5 endocrine and diabetes trainee in the Royal Gwent Hospital in Newport in the UK. He has cleared his specialty exam last year and was very much actively involved in all the discussions for the high yield facts since the last year and has been guiding other candidates in the group as well. So today we are going to cover all the high yield points, or we can say flashcards, or we can say high yield concepts, which are commonly tested in the endocrine and diabetes exams, the MRCP, in the specialty exam, as well as the European board exam. So with that brief introduction, I will hand over the presentation skills to Dr. Rana.
Hello, good afternoon, everyone. Thank you so much, Dr. Bazadalvi, giving me this opportunity to have some interaction with all my colleagues through this presentation. So my topic today is high yield points for endocrine exams. That can be all kind of exams. So I'll be covering these in probably 2 videos because there was a lot of content to cover. So it wasn't possible to do it in one video. So I have divided it into few slides, which can be divided further into 2 videos. So this is the index of the video now. So you can see this is the index of the first video, which we're going to cover today. That will include pre-lecture self-assessment. We'll give you a question paper, kind of 10 questions where you can just self-assess yourself how much you are prepared. And then there will be a few slides on the other topics which are mentioned here. We'll cover all of these topics in today's video, including renin and aldosterone interpretations, mechanism of important drugs involved in endocrinology, side effects of those drugs, some important lab diagnosis, genetic mutations, some very important numbers which we'll need to memorize because they are very frequently tested in exams, and some inheritance pattern. And these topics we will come back to later on in our second video. So this is the question. So this is the question paper which you will be having some time now to solve if you're able to do that. If you need some more time, you can pause the video so that you can try and solve it and self-assess yourself and see how many of these 10 questions you already know, how well you are already prepared, or which areas you've already covered well. So I won't tell you answers for these questions now, but hopefully by the end of both first and second videos, you will get answers to all these questions. They will be covered in this video. So question 1, what is the HbA1c threshold to start continuous glucose monitoring? Question number 2 is the side effects of mitotane. Question number 3, what is the test of choice for cyclical or subclinical Cushing's? Question number 4, hormone levels which are elevated in anorexia nervosa. Question number 5, half-life of carbimazole, propylthiouracil, and thyroxine. Question number 6, TSH targets post-thyroidectomy for DTC, differentiated thyroid cancer. Question number 7 will be indication of immediate referral to ophthalmologist. Very important questions. They tend to ask about diabetic retinopathy a lot. Question number 8 is example and indication of FGF23 inhibitor. Question number 9, important features of HPT-JT syndrome. Again, they tend to ask syndromes a lot in exams. And last, inheritance pattern of pseudo hypoparathyroidism. So we can always later on see how many you were able to solve. I'll move ahead now. So this is the next slide, very important topic, renin and aldosterone levels. So I can recall from my exam last year in 2021, there were at least 7 or 8 questions which were revolving around renin and aldosterone. So not all of them were asking for diagnosis, but there were renin and aldosterone levels mentioned for those 6 to 8 questions. So most important thing, you'll need to know how we divide into different classes as regards to renin and aldosterone levels. So I'll divide it into 5 classes. First one is low renin, low aldosterone. Very important from exam point of view. There are some very important topics there. Apparent mineralocorticoid excess, Liddle's syndrome, RTA4, Cushing's disease, non-classical congenital adrenal hyperplasia, 11-beta-HSD2 deficiency, which can be licorice ingestion as well. So these are very important topics. They will be tested in exam. So you'll need to know if there is low renin, low aldosterone, this is your differential diagnosis. There will be some other pointers leading towards the final diagnosis, but you will need to narrow it down. Similarly, next classification is low renin, high aldosterone. That's quite easy to remember. So these are the conditions where you can say they're all primary aldosteronism. So Conn's disease, bilateral adrenal hyperplasia, adrenocortical carcinoma, glucocorticoid remedial aldosteronism. These are all primary aldosteronism. They will present with high aldosterone, so renin levels will be low. And then number 5 is beta blocker. So beta blocker can also behave as if there is primary aldosteronism. So that's why it can give you a false positive result when you check for aldosterone renin ratios. And that can be another important exam question. If someone is on beta blocker, they are getting false positive, what would you do next? So the answer would be to go for a washout period of 2 weeks and then recheck again. Third classification, again, very important, high renin, high aldosterone. So these are the causes of secondary aldosteronism. So aldosterone is high, but that's high because renin is high, and renin is high because of these conditions. So it can be renal artery stenosis, it can be a reninoma, a tumor, or some conditions with high fluids in interstitial spaces like CCF, liver cirrhosis, nephrotic disease. And 2 important, again, exam conditions, Bartter syndrome and Gittelman syndrome. These are the causes of pseudoaldosteronism. They will present with high renin, high aldosterone. So you can see the Liddle syndrome is not in this category. It is low renin, low aldosterone. So you'll need to differentiate between these points before you get to your final diagnosis. And again, diuretics, hypertension, renal hyperperfusion, preeclampsia, and mineralocorticoid resistance are a few other causes. So I've not really gone into detail of everything like Gordon syndrome or Geller syndrome because they are very, very less likely to be tested in exam. So they will like to test you more on some endocrine things. So be aware of that, especially the first 2 classes, very important from exam point of view. Moving on, so we're moving towards the 4th class where there is high renin and low aldosterone. So that includes ACE inhibitors, angiotensin receptor blockers, classic congenital adrenal hyperplasia, and Addison's disease. So in this, you can see that it can cause high renin, low aldosterone. So it can give you a false negative result on ARR tests. So again, this can lead to another exam question now. If someone is on ACE inhibitor, you've done aldosterone renin ratio, and it's negative, what would you say? So I would say you would go for a washout period, which is usually 4 to 6 weeks. So after that washout period, you will check it again, and then you will have your final diagnosis. And last class is normal renin, normal aldosterone. That can happen with essential hypertension, with calcium channel blockers and alpha blocker. So again, you can have another question there, which drugs do not interfere with aldosterone renin ratios. So you can say alpha blocker like doxazosine and calcium channel blockers are safe to use while you're going to test aldosterone renin ratio to diagnose for primary aldosteronism or secondary aldosteronism. So these are very important questions with regards to renin and aldosterone. And obviously these questions I will test you again later on after the end of my second video. There will be another question, 10 questions where these will be tested. So hopefully you'll be able to answer them again. Moving on, next slide. So this slide involves few important medications. Obviously there are so many medications. They can be 50 to 100 important medications which they can test in exams. So I'll just touch base with the few more important ones which they like to test a lot. So mechanism of action are always asked in exams. So first drug is denosumab, and the mechanism of action I've already written for you. So not really asking you questions here, just giving you information for your quick revision now or maybe a few days before your exam. So denosumab binds rank ligand, prevents rank ligand binding to rank, and then decreases osteoclast survival and function and maturation, and in that way it decreases bone resorption. So a very important question they tend to ask with regards to denosumab is which bone cells does it interfere with? So two important points to note is that it binds with rank L, which are expressed on osteoblasts. And by that virtue, it prevents rank L binding to rank, and then it affects on osteoclast. So these are two different things. It binds with rank L, which are on osteoblast, not on osteoclast. But with that binding, it affects osteoclast and then causes decreased bone resorption. So this is a very important question. It's asked very frequently. Second important drug is metyrapon. So important mechanism of action, 11 beta hydroxylase inhibitor. So this is a steroid synthesis pathway question. I would say if I would be asked what is one important topic for SCE examination, I would say steroid synthesis pathway. So how the aldosterone or cortisol or other adrenal androgens are synthesized, which enzymes are involved, if they are inhibited, what can happen later, which results in hypertension by the virtue of that substrate accumulation, which can result in hyperandrogenism. This is the most important question. Third question will be PTU, propylthiouracil. What is the mechanism of action of propylthiouracil? It's not very difficult, it's an easy one. It is TPO inhibitor and also deiodinase 1 inhibitor. So reason for asking this question is, it is different from carbimazole. So carbimazole is TPO inhibitor only and doesn't interfere with DI1 inhibition. And by that virtue, we know that in thyrotoxicosis, thyroid storm, PTU is preferred over carbimazole. So that's another question. If someone is presenting in thyroid storm, which drug would you prefer? So I would prefer PTU over carbimazole because it also inhibits peripheral conversion of T4 to T3 by inhibiting DI1. Another important question. And there are a few other important drugs which inhibit conversion of T4 to T3. They are tested quite frequently as well, and we will discuss about those drugs later in our slides, either in video 1 or video 2. Next medication is fibrate. So mechanism of action of fibrate is it is PPAR alpha agonist, and by doing that, it increases LPL activity and increases VLDL clearance. So that's another important drug for the mechanism of action, which is very frequently tested. And don't confuse it with PPAR gamma agonist, which is thiazolidinedione drugs, which are used as oral hypoglycemics for diabetes treatment. So it's very easy to confuse between the two. Next important medication is tolvaptan. We all know it is used for the treatment of SIADH. SIADH is a very favorite exam question again. Mechanism of action is it's competitive, sorry, a competitive VR2 antagonist. An important side effect of tolvaptan is that it deranges LFTs. So again, you'll need to monitor LFTs. You'll have to be careful about, and there are so many other important endocrine medications which can derange liver function tests. So we'll discuss about those again a bit later in the video as well. So these are 5 important drugs, the mechanism of action of which you'll need to be very, very clear about, because they can come in exams along with so many other medications, which we will discuss later on as well. So just a prototype of those questions which can come in exam. Next slide. So again, there are few.
So the free view of this particular lecture has ended. For access to this full lecture session, please subscribe to my lecture series, which is total of 60 lectures till date. These will be provided access to via paid subscription plan, and all the paid subscribers will be given a lifetime access to all my existing 60 videos lectures, which are already on the YouTube channel, plus all the upcoming new videos. So whatever lectures or sessions I'll be doing in coming weeks, months, and years, all of them will be given access to in the same subscription plan. So for the full subscription details, please email me on mazirules@gmail.com or WhatsApp me on 009715574344794 and have the same number on the Telegram app as well. Just to give a brief overview of the full lecture series, so it includes different topics across diabetes and endocrinology. For diabetes itself is around 19 lectures which I've done across different topics which are useful for the exams as well as for the clinical endocrinology practice. In terms of high yield topics for specialty exam and European board exam, there are around 9 sessions which have covered all the previous exam recalls as well as all the high yield topics and themes which are frequently encountered in the specialty exams and the European board exams. In terms of thyroid, apart from the thyroid cancer guidelines, which were recently published, plus there are other sessions on different topics related to thyroid across the spectrum of thyroid disease. In terms of adrenal as well, covering all the important topics or sessions which are frequently encountered in exams and in clinical practice. There are 2 very good sessions on lab endocrinology by Dr. Velmurugan, very helpful for those preparing for DM endo or DNB endocrinology as well. In terms of pituitary also have covered all the important sessions on all the important topics which are frequently encountered in clinical practice and the exams. There are a few sessions on the inherited endocrine syndromes as well. Very important sessions on reproductive endocrinology, about congenital adrenal hyperplasia, gynecomastia, hirsutism, PCOS, diagnosis, evaluation, management. There is a sessions on calcium and bone metabolism, on familial lipid disorders, and sessions on pediatric endocrinology as well. So just to let you know that there are many more sessions coming up, and as I mentioned, that in the same subscription plan or same subscription fee, you will be provided access to all my existing 60 lectures plus all my forthcoming lectures. So thank you very much for subscribing. Thank you very much for supporting.